I'm Dr. Anthony Cave. I've guided thousands of ketamine sessions, and I want to talk about the latest news around Matthew Perry's tragic case from his passing in 2023 at the hands not of drug dealers as much as, well, I guess they're still drug dealers, as much as doctors. The most recent plea that came out a couple days ago from one of his suppliers is from a physician in Southern California. You're going to learn about everyone involved, and we're going to not talk about Elon Musk and his bladder for once. So moving on to these incredibly incriminating text messages that went around before his death and tragically right after his death. We're going to talk about each one and which of these characters whom the prosecutor's attorney, Estrada, has, I think, very accurately called out as putting other people's lives and putting greed over other people's lives. So who are these individuals that led to this horrible case with Matthew Perry that's not only hurt him, but has also potentially compromised the access that so many patients have to this powerful or potentially powerful medication that is not only life-changing in many cases, but can potentially be life-saving. Like I said, I use this regularly with many, many patients for all sorts of pain conditions, emotional and physical. And many patients are going to suffer, just like in the opioid epidemic. How patients, if you know what I'm talking about, let me know in the comments below. Patients that can't get the medications they need because of clowns like this. Jasmine Sangha, the ketamine queen, is what the prosecutor's attorney calls her. She, as you can see here, charging with storage, packaging, and distributing of narcotics, and also methamphetamines, by the way, to high-end celebrities, no less. She is the only of the 5 who has not yet put in a plea, by the way. We'll see when that happens. I suspect it's going to happen soon. She's the individual who sent a message shortly after Matthew Perry's passing. Delete all of our messages. This message was sent to Eric Fleming. We actually don't know very much about Eric Fleming other than the fact that he appeared to be somewhat of an acquaintance of Matthew Perry. Pardon, an acquaintance. He was a producer of TV shows and appears to have distributed the fatal dose that went to Perry, received from Sangha, from the ketamine queen, in addition to 50 other vials that were given to this individual, Kenneth Iwamasa, who we'll talk about in just a second. He's facing up to 25 years in prison. Then there's the individual who actually injected Matthew Perry himself. This gentleman here, Kenneth Iwamasa, apparently 25 years of a live-in assistant with Matthew Perry until he delivered the fatal injection. And here's the kicker. Matthew Perry in the last couple of weeks was documented as going out of control, spiraling out of control. And yet, not only was he still being supplied, but Kenneth was still injecting him, including the final dose. He injected Matthew Perry in the hot tub, ran away for some errands, and came back to find him no longer alive in the hot tub. The specifics of what happened, we've talked about in the show before. I'm happy to go into how I believe things played out in the final couple of minutes. Let me know in the questions or in the comments here. I see everyone here. Well, what's Kenneth doing these days? Getting ready for perhaps many years in prison? Not clear to me, but I don't know if he's being anyone's live-in assistant anymore. I'll tell you that. By the way, Judith, thank you. I hope my voice gets better soon as well. There are always bad seeds in every group that ruin things for the rest of us. Carrie, you couldn't be more right because we even have physicians involved in here. So Placencia was the physician who most recently put in his plea just a couple days ago, June 13th, not only for distributing the ketamine to Perry and falsifying records in the process, but also for apparently being aware that Perry was spiraling out of control and faces up to 40 years with his recent plea. Was there any chance that he could have been saved? Michael, we'll talk about that in the end. We will. I'm very, very keen to share my views on what could have been done in the days leading up to this. Certainly not ignoring being told that he's spiraling out of control, just giving him more and more of what he's asking for. That's not appropriate, needless to say. It's also not appropriate to be sending text messages like this. I wonder how much this moron will pay. And let's find out. to the fifth and final individual. This physician, Chavez, who apparently used to operate a ketamine clinic and had easy access to wholesale distributors of ketamine to be able to provide the medication to his former patients. What's wrong is to use the names of former patients and fill out prescriptions under the names of them to then divert to someone else, in this case, Matthew Perry. You can only imagine that he's in trouble as well. He's already put in his plea for guilty, faces up to 10 years. What can you take away from this? If you or a loved one is seeking this type of treatment, or quite frankly, any type of medical treatment, there's a difference between looking for a doctor who is looking for a bridge treatment for you versus one looking for a destination treatment for you. And I'm so curious if anyone here has even heard this term before, much less had their doctor discuss it. And I hope that you can come away from this appreciating that some practices tend to put patients more towards destination therapies, meaning they're going to be on a medication or some sort of intervention and be on it for the rest of their life, meaning they're going to die on it, versus being on a bridge therapy, which is a bridge, using a medication or some intervention as a bridge towards healing, hopefully with their innate healing capacity of their body. So maybe it's like a cortisone injection to help reduce inflammation in part of the body so the body can heal itself. Or maybe it's an antidepressant to overcome a difficult time in life, with the understanding that hopefully they'll be coming off of that medication in the future. Maybe it's an acid suppressor, maybe it's anti-anxiety medication, heck, maybe it's even a diabetes medication until someone potentially can change their lifestyle, versus the alternative of putting someone on a medication that they're going to be on for decades. Sometimes if someone's got very high cholesterol, well, the risk of a heart attack is going to be there for the rest of their life. Maybe a cholesterol-lowering medication is appropriate. But sometimes it's also appropriate to see what can we use this medication for the shortest period of time to minimize the risk of side effects. And like Al Phillips says, destination to heal or to live with a lifetime. Well said. Heather, so good to see you on here as well. Had some docs and nurses talk with me about this with meds. Candy, I think you're in the rare minority, given that no one else here seems to have heard of the difference between bridge and destination therapies. And I, like Carrie, agree that I would never want a handful of folks putting folks on destination therapies like what Matthew Perry had been stuck on, would scare folks to ultimately have an opportunity to pursue a treatment that might be appropriate. It's not appropriate for everyone, but it certainly has benefit for a lot of folks, especially when we look at the risks of an undertreated condition. With that said, I want everyone here to please share some questions. Remember that if you learn something new, share with your loved ones. Hit that like button to support me doing this for you more often. And as you know, I do use IV ketamine in many patients here in my clinic in San Francisco. And I couldn't be more dismayed by these, as someone earlier said, bad seeds that make this more challenging for everyone in the community who is trying to find the right doctor for this. PTSD actually has a lot of evidence for being benefited with ketamine as well. I prefer the IV approach in many folks because if something happens where something unpleasant comes up with a ketamine experience, you can pause an infusion in the way that you can't pause an injection or you can't pause a pill that's being digested or being absorbed under your tongue. Very good question. So Karma here was in clinic for so many patients today. Yeah, you see everyone who loves you. Yeah, we all love you. So she is our therapy dog in our clinic. And the best part is that, as some of you may have seen, I have her little pet therapy diploma next to our medical diplomas for the doctors. So, Judy, it's very, very funny and adorable. I agree. Please speak with your doctor about how you can make any medical intervention a bridge and not a destination so that we don't end up, with potentially ending up like Matthew Perry. You don't have to be famous. You don't have to be rich to end up stuck on a medication like this. It's a matter of advocating for yourself and hopefully having the support around you to allow your inner healing capacity to play through. So please remember that you have more power over your health than you've ever been told. Leave a comment so that I can do a video on something else that you're interested in. And please share with your loved ones. Hit the like button and see you guys next time.